Deborah Franklin with the Florida Healthcare Association, waiving in support. Do we have somebody from, well, whether it's Deborah or someone from the Florida Healthcare Association, would you mind taking a couple of questions here?
I'll get your card afterwards.
Thank you. I appreciate that. Much apprecited. Representative C. Smith, you're recognized for a question.
Thank you, Mr. Chair, and thank you to the Florida Healthcare Association for appearing before the committee. I know that you've been very involved in helping to write the bill. My question is, if we reduce the minimum staffing hours from 2.5 to 2.0, are there members in your association who are immediately going to slash hours and go straight to the minimum as a result of this bill?
Mr. Parker, you're recognized.
Thank you, Chairman. Thank you for the question. So I don't think the bill slashes hours. It reduces the amount of minimum CNA hours required. We wouldn't be working with Representative Mello on the issue of being able to have flexibility if people weren't going to take advantage of it.
Representative C. Smith, you're recognized.
In the staff analysis, it says the bill is expected to have a positive fiscal impact on nursing homes, resulting from an overall reduction in the professional level of care created by minimum staffing requirements. I'm hoping that you can perhaps provide the committee an estimate on how many tens of millions of dollars your member facilities are going to save as a result in this reduction in staffing hours.
Mr. Parker, you're recognized.
Thank you, Mr. Chairman. Thank you for the question. I would argue there's some buildings that are going to have higher costs. I mean, we're talking about physical therapists, we're talking about occupational therapists, respiratory therapists. Those folks all have a higher salary than CNAs. So, I mean, I don't know what the savings would be because every building's going to staff differently depending on the needs of their residents.
Representative C. Smith, you're recognized.
Thank you, Mr. Chair. So just for clarification, while you might not be sure what the savings will be, there will be substantial savings and a windfall for many of your member facilities. Is that correct?
Mr. Parker, you're recognized.
Thank you, Mr. Chairman. I wouldn't say there's going to be significant windfall savings. Again, it's going to be, you're going to have some buildings that don't reduce CNA hours at all because that's what they need. You're going to have other buildings that say, we need a respiratory therapist. We're trying to, there's obviously been a huge respiratory pandemic that's hit the country for the last few years. There's probably a lot greater need for respiratory therapists today than there ever has been. We worked with the legislature when they changed the payment system for Medicaid several years ago because there was a significant lack of ventilator care being provided in Florida. Created an add-on within the rate system to incentivize that. There's a lot of providers that would like to look at things like that, but with this one-size-fits-all model, they're not able to adjust and staff the way their residents need.
Representative C. Smith, you're recognized.
Thank you, Mr. Chair, and thank you again for the response. I'm trying to understand the impact of this bill in the context of the legislative environment that we're in right now. As I mentioned earlier in the committee, Chair Avila, thanks to his leadership, he is offering hundreds of millions of dollars in rate increases so that you can address the staffing shortage and the nursing staffing crisis. We also had the PCA bill from last year that is going to have some impact on some of your concerns around staffing costs in your facilities. My question is, why is it that in addition to the hundreds of millions of dollars we're giving you, in addition to the existing laws that have already been changed, why is it that you also need to have the staffing hours reduced by 30 minutes in addition to all of those things you're getting?
Mr. Parker, you're recognized.
Thank you, Mr. Chairman. And to echo the comments earlier, obviously, Florida Healthcare is very appreciative of the financial support that the House has put into the budget. It's about $125, $127 million in the House budget currently for nursing home rate increases. And that requirement is to take all employees to $13 an hour. We're pretty much there and past that with all of our CNAs. That's going to be a lot of our housekeeping, our dietary, those kind of staff. So I don't think that's going to make a huge impact on our CNA needs. I think every nursing home in the state would hire every CNA you could bring them right now for $13 an hour. Those folks just aren't there. So, I mean, the PCA program, the legislature passed the bill last year, very appreciative of that. It was in effect for a year prior to that already under emergency order from the governor's office. So that program's been running for 2 years. We've seen it's made an impact. It certainly has. But that's brought some new people into the workforce. But again, that doesn't address the underlying issue of this bill that allows people to staff according to their residents' needs. No one's going to rush out and get rid of all their CNAs to bring in a lot of higher paid staff if that's not truly what they need to take care of their residents.
Final question, Mr. Chair.
You're recognized, Representative.
Thank you, Chair Avila, and thank you for the response. My question is related to the possibility of this provision sunsetting. The staffing crisis that we're dealing with right now, we're all doing what we can to address it so that it is no longer an issue, but we have some work ahead of us. Are you willing to sunset this provision so that the change that we're making here by diluting the staffing standards that are currently in law is not a permanent change? Are you willing to not make this change permanent since the staffing crisis is temporary?
Mr. Parker, you're recognized.
Thank you, Mr. Chairman, and thank you again for the question. Again, I would contend that the staffing crisis isn't temporary. We've been saying for years that we had a staffing issue on our hands. COVID hit the fast forward button. I think the Florida Hospital Association put out a report recently on all the nursing needs, and we saw a report on all the specialist needs, and we have a huge CNA shortage in this state. And all COVID did was just speed that up. That was happening anyway. As the population continues to get older here in Florida, more seniors move here, there's more of a need for healthcare professionals. COVID just sped that up. So I don't think that, a sunset provision, if we thought this was going to be over in 6 months, I would agree with you on that, but I don't think it will be.
Thank you for the answer. So for the record, it sounds like you want to make permanent this reduction in staffing standards forever and ever. No further questions.
We can save that for debate. Representative C. Smith. Further questions? Further questions? Representative Skidmore.